Welcome back, everyone. This is English Talking Practice, and I'm your host, Lily. David's joining me today, as always. David, have you ever felt nervous going to a doctor's appointment in English?
Hello, listeners. Great to be here. Oh, absolutely, Lily. Even as a native speaker, medical appointments can be intimidating. I can only imagine how much more stressful it is in a second language.
Exactly. And that's why today's topic is so incredibly important and practical.
That's right. Today we're learning how to communicate at the doctor's office in English. Essential vocabulary and phrases for medical situations.
Health is one of those topics where clear communication isn't just helpful, it's absolutely necessary.
That's right. Whether you're living in an English-speaking country, traveling abroad, or studying medical English, these skills could literally save your life or someone else's.
But here's the challenge. Medical vocabulary is specialized. Words like symptoms, prescription, diagnosis aren't everyday conversation.
And when you're not feeling well, it's even harder to remember vocabulary or express yourself clearly.
Maybe you need to explain your symptoms, but don't know how to describe pain or discomfort in English.
Or perhaps you don't understand what the doctor is telling you but feel too embarrassed to ask them to repeat it.
That's what we're fixing today. By the end of this episode, you'll feel confident communicating about health issues in English.
So what will we cover? First, essential medical vocabulary, body parts, symptoms, and common conditions.
Then we'll practice making appointments, describing symptoms, understanding doctors' questions, and discussing treatments and medications.
We'll also cover phrases for asking the doctor to clarify or repeat, understanding prescriptions, and communicating at the pharmacy.
This knowledge is crucial for living abroad, traveling, emergency situations, routine checkups, and taking care of your health in English-speaking environments.
When the receptionist asks, "What's the reason for your visit?" or the doctor asks, "What brings you in today?" you'll know exactly what to say.
Before we begin this vital lesson, hit that subscribe button. This is information everyone needs.
And share this episode with anyone living, working, or traveling in English-speaking countries. Medical communication skills are essential.
Perfect. Let's dive in and learn how to talk at the doctor's office in English. Okay, David, let's start with basic medical vocabulary. What are the essential terms everyone should know?
Great starting point. Let's begin with doctor, the medical professional. You might also hear physician, which is more formal.
A general practitioner, or GP, is your regular family doctor. In the US, they say primary care physician, or PCP.
A specialist is a doctor who focuses on one area, like a cardiologist for heart problems or a dermatologist for skin issues.
The receptionist is the person at the front desk who schedules appointments. Very important person to communicate with.
A nurse assists the doctor and often checks your vital signs before you see the doctor.
Patient is you, the person receiving medical care. I'm a patient here, or I'm Dr. Smith's patient.
Now let's talk about why you visit the doctor. Symptom is a sign that something is wrong with your health.
For example, a headache, fever, or cough are symptoms. I've been experiencing some symptoms, or my main symptom is chest pain.
Illness or sickness means being unwell. I have an illness, or I'm sick.
Disease is a specific medical condition like diabetes or asthma, more serious than just being sick.
Injury is physical damage, like a broken bone or cut. I have an injury, or I injured my ankle.
Pain is physical discomfort. I'm experiencing pain in my lower back, or I have a sharp pain in my chest.
Ache is a dull, continuous pain. Headache, stomachache, backache, toothache.
Now, body parts. You need to know where the problem is. Head, throat, chest, stomach, back, arm, leg.
Abdomen is the medical term for your stomach area. I have pain in my abdomen.
Important internal organs: heart, lungs, liver, kidneys, stomach, the organ inside.
Vital signs are basic measurements: blood pressure, heart rate, temperature, respiratory rate.
Prescription is the doctor's written order for medication. The doctor gave me a prescription.
Medication or medicine is what you take to treat illness. I'm taking medication for my allergies.
Diagnosis is when the doctor identifies what's wrong. The diagnosis was a sinus infection.
Treatment is the medical care you receive. What treatment do you recommend?
Appointment is your scheduled visit. I have an appointment at 2 p.m. or I need to make an appointment.
Emergency is a serious, urgent situation. This is an emergency. Or should I go to emergency?
Allergic or allergy if your body reacts badly to something. I'm allergic to penicillin.
Side effects are unwanted effects from medication. What are the possible side effects?
These are the foundation terms. Now let's learn how to make an appointment.
Perfect. Let's practice that essential first step.
All right, David, let's practice making a doctor's appointment, usually done by phone or online.
Yes, this is often the first interaction. When you call, the receptionist will answer.
Let's do a role play. I'll be the receptionist. Good morning, Dr. Wilson's office. How can I help you?
Hi, I'd like to make an appointment, please.
Certainly. Are you a current patient or is this your first visit?
I'm a current patient. My name is David Chen.
Thank you, Mr. Chen. What's the reason for your visit?
I've been having severe headaches for the past week.
I'm sorry to hear that. How soon do you need to be seen? Is this urgent?
It's not an emergency, but I'd like to come in as soon as possible.
I have an opening tomorrow at 10 a.m. or Thursday at 2 p.m. Which works better for you?
Tomorrow at 10 a.m. would be perfect.
Great. I've scheduled you for tomorrow, Tuesday, December 27th at 10 a.m. with Dr. Wilson. Please arrive 10 minutes early to check in.
Perfect. Thank you so much.
You're welcome. See you tomorrow. If your symptoms worsen before then, please go to urgent care or call us back.
See, that's a complete appointment-making conversation.
Right. Key phrases: I'd like to make an appointment. I'm a current patient. What's the reason for your visit?
How soon do you need to be seen? Is this urgent? I have an opening at. Please arrive early to check in.
If it's your first visit, they might ask, do you have insurance? Or what insurance do you have?
You'd answer, yes, I have Blue Cross Blue Shield, or I'll be paying out of pocket, meaning you'll pay yourself.
They might also ask, who referred you? Meaning, who recommended this doctor?
If you need to cancel or reschedule, I need to reschedule my appointment, or I need to cancel my appointment for tomorrow.
Always give as much notice as possible. I'm sorry, but I need to reschedule my appointment on Thursday.
Now let's practice what happens when you arrive at the office.
Good idea. The check-in process is important.
Let's role play. Lily, you're the receptionist again. I'm arriving for my appointment.
Good morning. Are you checking in?
Yes, I have a 10 a.m. appointment with Dr. Wilson. My name is David Chen.
Perfect, Mr. Chen. I have you right here. Can I see your insurance card and ID, please?
Of course. Here they are.
Thank you. And can you confirm your date of birth?
March 15th, 1990.
Great. And is your address still 123 Oak Street, apartment 4B?
Yes, that's correct.
Perfect. Please fill out this form with any changes to your medical history. Then have a seat and the nurse will call you back shortly.
Thank you.
See? Quick and simple. Common questions at check-in. Can I see your insurance card? What's your date of birth? Confirm your address.
You might need to say, this is my first visit, or I've been here before, or my insurance has changed.
Quick reminder, if you're learning medical English, comment below. Tell us why this topic is important to you.
Yes, whether you're living abroad, traveling, or just preparing, we'd love to hear your story.
Perfect. Now let's talk about describing symptoms to the doctor. All right, David, this is crucial. Describing symptoms clearly so the doctor can help you.
Absolutely. The doctor will ask questions to understand what's wrong. Let's practice common questions and answers.
The doctor usually starts with, "What brings you in today?" Or, "What seems to be the problem?"
You respond by stating your main complaint. I've been having terrible headaches, or I have a sore throat and fever.
Next, they'll ask for details. When did this start? Or, how long have you had these symptoms?
Be specific. It started 3 days ago, or I've had this for about a week, or it began yesterday morning.
They might ask, is the pain constant or does it come and go?
It's constant means it never stops. It comes and goes means sometimes it's there, sometimes it's not.
On a scale of 1 to 10, how bad is the pain? This is very common. 1 is mild, 10 is the worst pain imaginable.
I'd say it's about a 7, or maybe a 5 out of 10. Be honest so they understand the severity.
Can you describe the pain? They want to know the type of pain.
You can say it's a sharp pain, sudden and intense, dull pain, not sharp, throbbing pain, pulsing, burning pain, or shooting pain.
Where exactly is the pain? Point and explain. It's in my lower back, on the right side.
Does anything make it better or worse? They want to know about triggers.
It's worse when I move, or it feels better when I lie down, or nothing seems to help.
Let's do a role play. I'll be the doctor. Good morning. What brings you in today?
Good morning, doctor. I've been having really bad stomach pain and nausea.
I'm sorry to hear that. When did this start?
It started 2 days ago in the evening after dinner.
Is the pain constant or does it come and go?
It comes and goes. Sometimes it's really intense, and other times it's just a dull ache.
On a scale of 1 to 10, with 10 being the worst pain, how would you rate it when it's at its worst?
Probably an 8. It's really uncomfortable.
Can you show me exactly where the pain is?
It's here in my upper abdomen, kind of in the center and slightly to the right.
Does anything make it better or worse? What about eating or drinking?
Eating definitely makes it worse. I haven't been able to eat much at all. Lying down seems to help a little.
Have you had any other symptoms? Fever, vomiting, diarrhea?
Some nausea, but I haven't actually vomited. No fever that I know of.
Any changes in your bowel movements?
Not really, though I have been a bit constipated.
Okay, thank you. I'm going to examine you now. Let me know if anything hurts.
Perfect role play. See how the doctor asks specific questions and I gave detailed answers?
Right. Other symptoms to know: fever, high temperature, chills, feeling very cold, fatigue, extreme tiredness.
Dizzy or dizziness, nausea, feeling like you might vomit, vomiting, actually throwing up,
Cough, congestion, stuffy nose, runny nose, sore throat, shortness of breath.
rash, red spots on skin, swelling, numbness, can't feel, weakness.
Always mention how long you've had symptoms, if anything triggered them, what makes them better or worse.
Now let's discuss what happens during the examination.
Yes, understanding what the doctor is doing helps you feel more comfortable.
During the physical exam, the doctor will check various things and tell you what to do.
They might say, I'm going to listen to your heart and lungs. Take a deep breath in and out.
Or, I'm going to check your blood pressure now. Just relax your arm.
Open your mouth and say, ah. This lets them see your throat clearly.
I'm going to press on your abdomen. Let me know if anything hurts.
Look up, look down, follow my finger with your eyes. They're checking eye movement.
Can you lie down on the examination table? Or please sit up now.
If something hurts during the exam, say, that hurts, or that's tender, or ouch.
They might order tests. I'd like to run some tests. Or we need to do some blood work.
We're going to draw some blood means they'll take a blood sample with a needle.
After examining you, the doctor will give their diagnosis and treatment plan.
Let's practice that part. David, you be the doctor again.
Okay, based on your symptoms, I believe you have gastritis, inflammation of the stomach lining.
Oh no. Is it serious?
It can be uncomfortable, but it's treatable. It might be caused by stress, spicy foods, or certain medications. Have you been under stress lately or taking any pain medications like ibuprofen?
Yes, I've been very stressed at work, and I did take ibuprofen a few times last week for headaches.
That could be contributing to it. Here's what I recommend. First, I'm prescribing an antacid medication to reduce stomach acid. Take it twice daily before meals. Second, avoid spicy, fatty, or acidic foods for now. Also avoid alcohol and caffeine, and try to manage your stress. That's very important.
Okay, how long until I feel better?
You should start feeling better within a few days, but take the full course of medication. If symptoms don't improve in a week or if they get worse, call us immediately.
Should I be worried about anything else?
If you develop severe pain, vomiting blood, or black stools, go to the emergency room immediately. Those would be signs of something more serious, but I don't expect that to happen.
Okay, thank you, doctor.
You're welcome. I'll send the prescription to your pharmacy electronically. You can pick it up in a couple of hours. Any other questions?
No, I think I understand everything.
Great. Take care and feel better soon. Perfect. That covered diagnosis, causes, treatment, medications, warning signs, and follow-up.
Right. Key phrases. Based on your symptoms, I believe you have, it's treatable, I'm prescribing, avoid, if symptoms worsen.
If you don't understand, always ask. Could you explain that again? What does that mean? Can you write that down?
Never be embarrassed to ask for clarification about your health. Now let's talk about prescriptions and the pharmacy.
All right, David, let's discuss understanding prescriptions and talking to pharmacists.
Yes. After seeing the doctor, you often need to get medication from a pharmacy or drugstore.
The doctor will give you a prescription, either paper or send it electronically to the pharmacy.
When you go to the pharmacy, approach the pharmacy counter, not the regular checkout.
Let's roleplay. I'll be the pharmacist. Hello, how can I help you?
Hi, I'm here to pick up a prescription. My name is David Shen.
Let me check. Yes, I have one prescription ready for you. Date of birth, please?
March 15th, 1990.
Perfect. This is omeprazole, 20 milligrams. Take one capsule twice daily before meals for 2 weeks. Have you taken this medication before?
No, this is my first time. How exactly should I take it?
Take one capsule in the morning before breakfast and one in the evening before dinner. Swallow it whole with water. Don't crush or chew it.
Okay. Are there any side effects I should know about?
Common side effects include headache, nausea, or diarrhea, but most people tolerate it well. If you have severe side effects or allergic reactions like rash or difficulty breathing, stop taking it and call your doctor immediately.
Got it. Can I take this with other medications? I sometimes take ibuprofen.
Actually, you should avoid ibuprofen while treating gastritis. It can make it worse. If you need pain relief, use acetaminophen instead, like Tylenol.
Okay, good to know. Anything else I should avoid?
Try to avoid alcohol and take the medication consistently at the same times each day. Don't stop taking it early, even if you feel better. Complete the full 2 weeks.
Understood. How much do I owe?
With your insurance, your copay is $15.
Great, here's my card.
Perfect. Here's your medication and information sheet. Do you have any other questions?
No, I think I'm all set. Thank you so much.
You're welcome. Feel better soon.
Excellent. That covered everything you need to know at the pharmacy.
Right. Important phrases. I'm here to pick up a prescription. How should I take this? Are there any side effects? Can I take this with other medications?
The pharmacist will explain dosage, how much, frequency, how often, duration, how long, and any precautions.
Common instructions: take with food, take on an empty stomach, take at bedtime, complete the full course.
Medication forms: tablet, capsule, liquid, syrup, cream, ointment, drops, inhaler.
If you're feeling much better thanks to learning this vocabulary, give us a thumbs up and share with anyone who needs medical English.
Yes, this could genuinely help someone in an emergency or important medical situation. Share the knowledge.
Perfect. Now let's do our recap and pronunciation practice. All right, everyone, let's recap everything we learned about communicating at the doctor's office.
We covered medical vocabulary, making appointments, describing symptoms, understanding examinations, and getting prescriptions.
Let's review key medical terms. Say them with me: doctor, patient, symptoms, pain, prescription, medication, appointment, diagnosis, treatment, pharmacy.
Perfect. Now, pronunciation practice. First word, symptom.
Symptom,
Prescription.
prescription,
Diagnosis.
diagnosis,
Pharmacist.
pharmacist.
Excellent. Now, key phrases. Repeat after me. I'd like to make an appointment.
I'd like to make an appointment.
I've been having headaches for 3 days.
I've been having headaches for 3 days.
On a scale of 1 to 10, the pain is about a 7.
On a scale of 1 to 10, the pain is about a 7.
Could you explain that again, please?
Could you explain that again, please?
How should I take this medication?
How should I take this medication?
Are there any side effects?
Are there any side effects? Perfect. Now question-answer pairs.
What brings you in today?
I've been having a fever and sore throat for 2 days. When did the pain start?
It started yesterday morning after I woke up. Does anything make it worse?
Yes, it hurts more when I swallow or talk. What medication are you currently taking?
I'm taking blood pressure medication and a daily vitamin. Do you have any allergies?
Yes, I'm allergic to penicillin and shellfish. Excellent. Remember, clear communication about your health is crucial and could save your life.
Don't be afraid to ask questions. Ask for clarification or ask the doctor to slow down. Your health is priority.
Now let's wrap up with our question of the day. Well, David, I hope everyone feels more confident about medical appointments in English now.
Me too. Medical situations can be scary, especially in a second language, but having the right vocabulary makes such a difference.
Absolutely. Being able to describe symptoms clearly helps doctors diagnose and treat you properly.
Thank you all for learning this essential topic with us today.
Here's your challenge. Write down 3 common symptoms in English and how you would describe them to a doctor.
Practice saying them out loud. The more you practice, the more natural it becomes in real situations.
Now for our question of the day.
We'd love to hear from you. Comment below.
Question of the day. Have you ever been to a doctor's appointment in English? What was the most challenging part? Or if you haven't yet, what concerns you most about it?
For example, yes, I went to the doctor in London. The hardest part was understanding the prescription instructions. Or, I'm worried I won't be able to describe my symptoms accurately.
Your experiences help others prepare. Share your stories and concerns in the comments.
Remember, doctors want to help you. If you don't understand something, it's okay to ask them to explain differently or write it down.
Your health is too important to pretend you understand when you don't. Always ask questions.
Whether you're preparing for life abroad, traveling, or just want to be ready, this vocabulary is essential.
All right, that's our important episode for today. I'm Lily.
And I'm David.
Thank you for joining us on English Talking Practice.
If you haven't subscribed yet, please do. We cover essential topics like this to help you navigate real-life situations in English.
And comment below with your medical appointment experiences or concerns. We're here to help.
Stay healthy, keep practicing, and remember, clear communication saves lives.
Until next time, take care of yourselves.
See you in the next episode.